On behalf of Australian Cancer Research Foundation, I am thrilled to announce the Grant Award for 2022. This project, and all those that ACRF has funded since 1984, is only possible thanks to the ongoing generosity of supporters like you. Your continuous commitment to helping ACRF back brilliant science is enabling researchers to progress life-saving outcomes for people impacted by cancer. This year, we are proud to award $2.1 million to the Olivia Newton-John Cancer Research Institute to establish the ACRF Centre for Precision Medicine. This world-class radiochemistry laboratory will take us forward in our mission to reach a world without cancer by accelerating discoveries in the lab for use in clinical settings.
So the ACRF Centre for Precision Medicine will provide a unique and exciting opportunity to translate discoveries. We'll be looking at precision medicine, which is a way in which you identify targets within the cancers that patients will present with, and then tailor individually the treatment that they will receive. We'll be utilising and developing novel imaging techniques to be able to image the cancers in the body and the targets which are present within these cancers. The Theranostics approach to cancer treatment is really summarised by, if you can see it, you can treat it. So we used novel imaging techniques to identify the targets that are present within the cancers and then match them to therapies which will work specifically on the targets, increasing response rates and reducing the side effects that are seen with more conventional treatments.
The centre will allow us to generate probes that we can then monitor in specific pieces of equipment to see where particular molecules travel through the body and whether or not a particular molecule has an activity to kill a cancer cell. So that's the first thing. The second approach is to identify where in a patient there are still very small numbers of cancer cells that otherwise we couldn't identify. And again, we use molecules that we attach radioactivity to, and of course we then can determine where the radioactivity is in the body and therefore where the cancer cells are. And the third approach is really that we can use molecules and attach very specific radionucleotides, and these molecules then single out cancer cells, and the radioactivity that is attached in these radionucleotides will allow to kill the cancer cells. So there are really three major applications. It is an absolute honor that ACRF has chosen our proposal to be funded. I really want to thank all the donors of ACRF for their generous donations they have made over the years, because it's of these generous donations that they can fund the Centre for Precision Medicine.
Funding from the Australian Cancer Research Foundation has been absolutely essential to us to be able to bring together the team that we've assembled and also the capability to be able to undertake the research and the translation into the clinic. You need that type of infrastructure and program in order to make the big discoveries, to make the big translations into the clinic. And it's only through the generosity of the supporters and the Australian Cancer Research Foundation that we can undertake these programs, and we're very grateful for this support.